everyone. Thank you for attending the virtual information session for the University of Pennsylvania Post-Baccalaureate Pre-Health Programs. What I'm going to do is introduce you to the programs that we offer here at Penn, run through some of the distinctions and some of the program requirements, give you a little bit of information about how you apply to the program, and then I will open it up to questions and answers. What you should do at this point is think about what questions you have. Go ahead, you can start putting your questions in the Q&A portion. If you forget to put it in the Q&A, put it in the chat. We'll still respond to it in the chat. Faye, who's our program coordinator, is going to be putting some information into the chat for you. So that's where you'll find some, links to other important things on our website and also information about our deadlines for application. So once again, thank you for joining us this evening. I'm really glad to be able to be with you. My name is Jackie McLaughlin, and I am the director for the pre-health programs at the University of Pennsylvania. During this presentation this evening, while we're going through the distinctions about the program, I want you to think about why the Penn pre-health program is a good fit for you. And how do you envision participating and contributing if you are offered admission to the Penn pre-health programs? So those are things that can be helping you to even prepare for an interview, should you be invited to interview for the program. At the University of Pennsylvania, we have two distinct programs that are preparatory programs. We have the core studies program, which is designed for career changers. So this would be a person who was an English major or maybe an engineering major, a psychology major. And at some point along the line, your career path evolved. And at this point, you want to pursue either medicine, dental medicine, or veterinary medicine. And you're looking for a program to help to prepare you for that. Exactly what we do in the core studies program. The other program that we have is the specialized studies program. And this program is also for people who want to pursue medicine, dental medicine, or veterinary medicine, but maybe you were a biochemistry major or a biology major, and you do have that science background, but you want to strengthen the background that you have so that you can be a stronger applicant when you get to the point where you're ready to apply to either medical school or veterinary school or dental school. So those are the two distinctions. I'm going to drill down into talking about the core studies a little bit first. So the minimum requirement for the number of courses that you need to take is 12 course units. And the courses are listed here. So you have a general chemistry sequence. These are laboratory courses, general bio sequence, bio 1 and 2, and the laboratories associated with that, organic chemistry and the lab course associated with that, physics and the laboratory courses associated with that. Those 4 subject areas add up to the 12 CU minimum. Most of the people who will be in this program are going to need beyond those 12 CUs. So we also have biochemistry, which is really important for every single, one of you who's looking to go into medicine or veterinary medicine or dental medicine. And then there are additional courses as well in physiology, cell biology, microbiology, histology. Those courses might be required for some programs in dental medicine or in veterinary medicine. Some students might also need some specific prerequisites for schools that they're applying to, such as calculus or biostatistics, something like that. So those are all discussions that you want to have with your advising team when you're here so that we can help you plan the correct curriculum for you. Now, the core studies program is distinct from the specialized studies program in that it is really math intensive, and math mastery is expected. So this is something that you can prepare for before you come into the program. You should be thinking about your math. Do you need to have any additional math before you submit an application? I've listed here the math skills that you need to have. So if they're not familiar to you, then you'd better start, thinking about, oh, maybe I should be taking some additional math. It's important for you to know that a college level pre-calculus course is definitely a prerequisite for admission into the core program. If you haven't had that, by all means, if you're still an undergrad, look for that, or maybe you could take that at a community college before you would be planning to enroll at Penn. For students who have AP credit, that AB and BC calculus with a score of 4 or above will also satisfy that prerequisite for the core studies program. The core studies timeline, we allow all students up to 2 years to complete your program requirements. There is a 1-year accelerated timeline available for some students with a summer start, and that has to start with general chemistry. Students who want to do the accelerated 1-year timeline do need approval from me. Our international students, we do accept a small number of international students every year, and international students, because of visa requirements, are required to start in the summer and follow a 1-year timeline. They don't have any flexibility in doing it on a different timeline. So that's something, if you're an international student, to be aware of as well. We discourage core students from working or planning to work. It is against advisement. This is something we will always talk to you about in your interview. If you're invited to interview, is what your plan is, what your timeline is. Are you considering working? Because that can undermine your ability to do well in the program. And if you're not able to do well academically in the program, you're not going to be able to move forward towards reaching your goals. So this is something that's really important for you to think about and have a plan for how you're going to support yourself and deal with this financially without thinking about, working full time. It may be that after you're in the program for a little while, you may be able to advance to working part-time when you are able to balance all of the coursework, but that's something, again, you need to discuss with the person who interviews you for the program and also with the advising team. One thing that you should be aware of is that this post-baccalaureate program is not what we would consider a cohort program. Cohort programs typically have students all starting at the same time, and they are all taking the same classes. So while you're not a cohort program, you are in classes with your pre-health peers. So that is one of the things that is unique about this program. You are not in classes with regular Penn undergrads. We roster these classes specifically for our students in the pre-health program. But we accept people who come in with all different backgrounds. So you're not all taking the same courses at the same time. And we have different points during the academic year when students can come into the program. So everybody's not following each other with exactly the same pattern. We individualize and tailor your program based upon your academic history and what you really need. The specialized studies curriculum is a little bit different. It's 8 CUs, so a little bit less than the core. And again, that's a minimum. So it depends on what career direction you're going in, what courses you might need to take. In the specialized studies program, our classes are held in the evenings during the fall and spring, and summer classes are in the day and in the evening. So that's something that you need to think about, because classes, if you're taking classes in the summer, you need to assure that you're available during those daytime hours. So with the specialized studies timeline, again, we allow students up to 2 years to complete their program requirements. A full-time student is 3 CUs at the University of Pennsylvania. Students may take up to 4 CUs, so a specialized student might want to go through this program, taking 4 CUs in the fall and 4 CUs in the spring. That's perfectly acceptable. You also should know that many of our specialized study students are going through the program, taking 2 CUs a semester, and many of them are working full-time and taking 2 CUs a semester. That's very doable as well. And that's one of the ways that many of our specialized study students finance their education, because as a full-time employee at the university, they're able to get support for tuition remission. But what happens if you don't neatly fit into the core studies program, or you don't neatly fit into the specialized program and you're not sure which program is right for you? I would suggest that you just look at how many of the basic core courses you have. If you've had fewer than 50% of those courses that are recommended for the core, then you should be definitely applying to the core studies program. If you've had, say, 8 of those, basic core courses, specialized program might be a better option for you. But it depends on how strong of a student you are. For someone who's a little bit weaker student, we might recommend that they stay in the core and take a few more advanced courses to really strengthen their application. So I would say, if you're not sure, just use that advice I gave you, apply to the program that you think is the best fit for you. And if we invite you to interview for the program, we will tell you how, we would adjust you if we recommend that you switch between the core or the specialized program. We'll take care of that on this end, okay? The pre-health math on-ramp is something that I want you to understand. We have a math review course that is a required program requirement for any student, whether you're core or specialized, and you are planning to enroll in either of, Chem 1 or Chem 2 of the general chemistry sequence, or Physics 1 or Physics 2. Some specialized students might be, have a gap and need to take the second semester of physics or the second semester of chemistry. So they might find that they're assigned to take the math on-ramp. It's important to know if you need to do the math on-ramp because it's only offered in the summer session. It is not a tuition-bearing course. It is not a credit-bearing course. It is a review course that we have planned and designed for you here at Penn so that you will be prepared for the math that you need to be successful at Penn. The math on-ramp is, there's a small fee associated with it to cover the cost of development for us for the course, and that is $100 a student. We roster this course during the summer session, so there are 11 weeks for a student to complete the course, and it certainly doesn't take 11 weeks to do it. You could do it in several weeks, but we give timelines for when we expect you to complete certain modules in the course so that you don't let it go to the last minute, because it is considered a program requirement if you are assigned to the course. What do we offer here for pre-health students at Penn? For our core study students and for our specialized study students, we offer basic STEM curriculum and advanced biological sciences, individualized study plans, academic advising, career counseling, flexible timelines between full and part-time study. We have workshops every semester on how to, complete your applications to the health professions, on writing, on interviewing. We did offer a discounted MCAT prep course. We have a virtual online pre-health community where we communicate all sorts of information that you need to know about the program to the students. We have distinguished speaker events, alumni panels, and networking opportunities for our students. There's a weekly pre-health journal club, and our Post-Bac Society, which is our organization or student governance organization for our students, has multiple special interest Oops. Okay. Has multiple special interest groups, such as a chapter of AMWA, which is the American Medical Women's Association. We have an affecting social justice and medicine group. We have a pre-SELMA group for students who are interested in osteopathic medicine, pre-dental club, and a monthly book club that has just launched just this fall. Students are also assigned a peer mentor, and we offer a non-credit tuition-free peer education course on social determinants and health disparities in medicine. How does pre-health advising work? You are assigned a pre-health advisor, but you don't just have one advisor. You're assigned to a team of advisors. So we work together as an advising team. The very first step when you're a newly accepted student is to schedule your first advising appointment. This gives you an opportunity to get connected with the resources at Penn and the Penn pre-health community to create an initial study plan with the pre-health advisor and talk about your timeline to completion and get some basic guidance on an initial plan of study for course selection. We recommend that you schedule to meet with all the pre-health advisors on the team in your first semester so that we all get to know you. And then you really should be thinking about coming in for advising at least twice every semester after that, if not more often, but that sort of is a minimum. So what is our approach to advising? It is basically the tenets of developmental advising, and a lot of the practices of appreciative advising are integrated into our advising approach. It's a collaborative process to assist you in optimizing your progress towards reaching your dreams and your goals. We don't tell you what to do. We provide realistic assessments and focus on facts that lead students towards success. We encourage your development in aspects of decision-making, problem-solving, and goal-setting. And we're interested in your growth academically and in your extracurricular experiences as well. Pre-health programs are not certificate programs. They are preparatory programs. That's a distinction. We do offer certificates, but we do not give you a certificate of completion at the end of the program. That would make it a certificate program. We're a preparatory program that offers certificates of academic achievement. These are the requirements listed here on this slide for the certificates of academic achievement. We do an audit of students who have earned their certificate once a year, and then that award is noted on your Penn transcript, and you are sent an actual certificate that you can frame and put on your wall. We have some exclusive linkage opportunities. There are fewer linkage opportunities than there used to be in years past. Things are changing in terms of what some of the medical schools are looking for in terms of their entry class. We also have not listed here is we have an informal linkage opportunity with Rutgers, New Jersey Medical School. They support a linkage, agreement for our students as well. In addition to what criteria are established by our partners in our articulation agreements, we also have internal criteria for linkage candidates, and we offer information workshops on linkage every semester. So if you think you're interested in a linkage opportunity, you should take a look at these particular schools and then have that discussion, open up that discussion at your initial interview, and then also at your first advising, so that we can help you gather as much information as is important for you. Our admission information is here. Our applications you would access them through Post-Baccalaureate, and our admissions are reviewed on a rolling basis. For the core studies program, we accept applications in summer and fall only. And for the specialized studies program, you can apply to any semester, to fall, spring, or summer. The deadlines are listed here. You'll note that we do have an early decision deadline, February 15th. That's for both core and specialized, but be aware, that there are some different deadlines for the different programs. And that brings me to the end of the slides. And now we're going to move on to the questions and answers. So